Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is an overview of failed back surgery syndrome. Failed back surgery is when the outcome of low back surgery fails to provide the desired outcome. The result turns up chronic pain, which is termed failed back surgery syndrome. It's one of the most frustrating things a patient can deal with since he or she went into the surgery route hoping for a pain-free outcome, and it just didn't happen. Studies show that up to 40% of all back surgeries end up failing. 10% of back surgery patients actually end up worse than they were before the surgery. Each time you have additional surgery as a revision, it has a lower chance of success than the one before. Overall, it can be an exceptionally depressing situation. Well, why does it occur? Now, number one would be surgery could be performed for the wrong reason. Even the best board-certified, fellowship-trained, veteran spine surgeons get it wrong 50% of the time as to why your back hurts. Okay, it just is what it is. It's one of the limitations of modern medicine. Also, it could be that surgery was performed for the right reason, but it left the person with residual pain. It just could be a technically perfect surgery, it just didn't work fully. And that's another one of the myths or realities of modern medicine, is that we just can't always get rid of all the pain, even if the hardware is put exactly right, the surgery is done perfectly. The third is that the surgery could be inadequately performed. Maybe the nerve roots weren't fully decompressed. Maybe the hardware wasn't put in very well, what have you. Fourth is that maybe the hardware is put in properly, but the fusion just didn't occur, and then the hardware breaks, and you end up with more pain than before. That one often is a fixable problem. The fifth is that the outcome was satisfactory initially, but then scar tissue formed around the nerve roots maybe a year later. Could be painful hardware, it could be adjacent segment degeneration above or below, is seeing too much stress and breaking down and causing pain. So here's an example of adjacent segment degeneration. You see a two-level fusion here with hardware on the right, the left, and then a cross connector. Now, fusion occurs, but then you get a lot of breakdown. See, this level looks great here, but here you have significant breakdown. It's actually almost auto-fused with bone coming around. Okay, big time degeneration here. That's what we're talking about. Well, what are the symptoms of failed back surgery? Daily back pain. It may radiate out into your flank or into your buttock area. Can have spasms and aching. Also may have sciatica if nerve roots are involved, with leg pain and burning and numbness. When it comes to treatment options for failed back surgery, the first is the person should have a surgical evaluation to see if a revision might help, something such as broken hardware or adjacent fractures or something like that. If that's not in the cards, then physical therapy, chiropractic treatment can help. Spinal decompression therapy, which is computerized intermittent traction, may be great. It's not indicated, though, if a person has hardware in place in their neck or low back. Acupuncture can be a great treatment along with medication management. This may include over-the-counter medications, anti-inflammatories, Tylenol. Could include Lyrica or Neurontin if there's nerve root type pain, muscle relaxers, and then narcotics may be extremely beneficial to help a person be functional and work and be able to play with their kids and so forth. Interventional procedures, trigger point injections can help. They're subcutaneous and they help with spasms and aching. Another would be hardware injections to see if the hardware is in fact causing pain. If you inject around the hardware and it relieves a lot of the person's pain, it may be that the hardware should come out. A facet or a medial branch block effectively is when you put steroid or numbing medicine into the joint itself that is deemed to be one of the sources of pain. Okay, or a medial branch block is when the numbing medicine and steroid goes around the joint and deadens the nerves that are causing that bring sensation to the joint. All right. If that works and wears off, then a radiofrequency ablation can deaden those nerves for 6 to 18 months. Okay. If a person's having nerve root-related pain, then an epidural injection can be very helpful. Last resort would be a spinal cord stimulator implant. It's been a revolutionary treatment for failed back surgery. It keeps getting better with the technology for the device. Now, the programming is good for both back and leg pain. There's usually over 200 programming options available. Over 75% of patients do extremely well with spinal cord stimulator implants. Keep in mind, they don't fix the problem at all. They just mask it. Okay, they can take pain that's sharp and stabbing and turn it into a a pleasant tingling type sensation that basically masks the pain. Okay. Initially, you have to get a trial put in for 5 to 7 days, and then that just involves some leads going around the spinal cord, and it goes outside the skin. That's taken out in the office, and if it works well, then the person gets scheduled for the final implant. They have a psychological evaluation, which is insurance mandated, and the final involves a little bit of bone taken out. These leads go around the spinal cord. This is still under the skin, and this is put just above the buttock area underneath the skin. It's a programming unit and a battery pack. You can charge it outside the skin with like a belt while you sleep. So the new ones are great. The top non-operative pain management is through the New Jersey Pain Network. There are several clinics throughout the state, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.